Hello, I'm Carla Levinson. I am an elder law attorney. I'm a mom, I'm a caregiver, and today we are going to be talking about the difference between Medicare and Medicaid. I've touched on this topic in several of my other videos, but I wanted to go in depth a little bit more today about it because it is something that people get confused very often. Unfortunately, the names are very similar, but they are two very different programs. So let's talk about the difference between the two and how they play into paying for long-term care. Starting with one of the most common misconceptions that people have when they come into my office, they think that because they have Medicare, that means that their long-term care will be covered. Medicare does not pay for long-term care. Medicare is federal health insurance for Americans over the age of 65. Certain younger people may also qualify for Medicare under certain circumstances. The only nursing care that Medicare will cover are short-term stays in a skilled nursing facility and only if you meet certain criteria. Skilled nursing care is care that you need that can only be performed by skilled professionals, such as physical therapists, doctors, nurses, or other skilled providers. If you need care and supervision because you need assistance with activities of daily living, like getting dressed, getting in and out of bed, eating, bathing, or toileting, Medicare considers this to be custodial care, and this type of care is not covered. Medicare will cover a short-term skilled nursing stay, only up to 100 days, and only if you meet certain criteria. You first need to have a qualifying hospital stay, a stay where you are admitted as an inpatient and you are there for at least 3 midnights. If the hospital doesn't admit you and just keeps you there under observation, this does not count towards your qualifying stay. Your doctor also needs to order that you need inpatient skilled nursing care. If you do have a qualifying hospital stay and your doctor states that you need skilled nursing care, then Medicare will cover you, but only up to 100 days. There are some exceptions and intricacies about how the benefit period is calculated, but the general rule is that a new benefit period will restart for you if you haven't been in a hospital or a skilled nursing facility in the last 60 days. Medicare then resets the clock and will cover your skilled nursing needs up to 100 days if you have another qualifying stay and the doctor says you need skilled nursing services. For a more detailed explanation of how Medicare calculates your benefit period, go to medicare.gov and read their manual titled Medicare Coverage of Skilled Nursing Facility Care. And also, Medicare will only provide this care as long as it's medically necessary, even if you've been receiving the care for less than 100 days. Medicare will pay fully for the first 20 days, but for days 21 up to 100, you will have to pay a daily coinsurance and Medicare will pick up the rest. If you have a supplemental Medigap health insurance policy, that policy may also cover your daily coinsurance. I wanted to talk about this because I think it's really important to understand exactly what Medicare does cover and what it doesn't cover, because time and again, I have clients coming in to see me and they do not understand how much Medicare coverage they are entitled to, or they don't understand that if their loved one needs assistance with activities of daily living only, then their skilled nursing stay is not going to be covered.